Even though the rain has eased in the flood-hit city of Chennai, various health threats will persist in the coming weeks. These health threats can be grouped into 4 basic categories: wildlife displacement, vaccine-preventable diseases, insect-borne diseases, and food and waterborne diseases. Wildlife displacement. Rodents, snakes, and other animals that may have been displaced by the flooding may also carry diseases such as rabies and leptospirosis. Therefore, you should avoid encounters with animals. This includes carefully checking for any animals when re-entering your home to avoid injury. If you are bitten or scratched by any wild or domestic animal, seek immediate medical attention. Vaccine-preventable diseases. Crowding in evacuation shelters and homes increases the risk of infectious diseases, especially vaccine-preventable diseases, such as influenza, measles, tuberculosis, and meningococcal disease. To protect yourself against such diseases, see a doctor to ensure you're up to date on all recommended vaccinations. Even if your immunizations are up to date, it is still important to practice basic hygiene measures, such as 1. Cleaning personal areas and work surfaces using 240 milliliters or 1 cup of bleach and 18.9 liters or 5 gallons of water. 2. Washing your hands, especially before eating and after sneezing, coughing, or blowing your nose. Use an alcohol-based hand sanitizer if soap and water are unavailable. 3. Keep your hands away from your eyes, nose, and mouth unless you just washed your hands. And 4. Distancing yourself from individuals who are clearly sick. Insect-borne diseases. Since standing water provides an environment ideal for mosquito breeding, there will likely be an increase in the number of mosquito-borne diseases in the coming weeks, such as malaria, Japanese encephalitis, chikungunya, and dengue fever. The most basic way to protect yourself against mosquito bites is to wear insect repellent with at least 35% DEET. However, when weather permits, you should also cover as much skin as possible by wearing long sleeves, long pants, socks, shoes, and a hat. And remember to spray repellent not only on exposed skin, but also on your clothing. Also consider sleeping under an insect-treated net for bedding until cleanup efforts are complete. And last but not least, it is important to frequently remove standing water that can be found in places like open trash bins, potted plant saucers, tires, and buckets. And don't forget to remove standing water from outside and inside your home, office, and work site. Food and waterborne diseases. Since the floodwater in the water supply could have been contaminated by sewage, animal waste, and diseases such as cholera, typhoid fever, and leptospirosis, be sure to avoid contact with the floodwater, especially slow-moving or stagnant water, and water frequently visited by animals. However, if contact with the floodwater is unavoidable, be sure to wear protective clothing and footwear. Also be sure to drink only water that has been boiled, purified, or bottled water from a reputable distributor. And don't forget to wash any foods, including canned food, containers, cooking utensils, and dishes with clean, sanitized water before use. Following the basic health precautions presented in this video will help protect you against the flood-related health threats that will likely persist in Chennai in the coming weeks. For additional information, please visit ijet.com.